I have always felt in control of my life. You certainly realise suddenly that you're not bulletproof, which is not something that I ever contemplated.
You're in hospital with people who are very, very sick, people who are in a lot of pain, people who are very frightened, and people who know they're dying, basically. And so it's quite a confronting environment from that point of view.
The Nelune Foundation is a not-for-profit charitable organisation that is committed to helping all cancer patients fight cancer with dignity, irrespective of their social or financial circumstances. Established 12 years ago by two friends, Anna Gillen and Nelune Rajapakse, the Nelune Foundation has given practical support to thousands of people by providing complimentary transport, financial assistance and funding of post-operative medical aids to patients across Metro and regional New South Wales. In 2012, the Foundation committed $2.5 million to establish the Nelune Centre at the Kinghorn Cancer Centre, Sydney. Now, the Nelune Foundation is undertaking its greatest fundraising challenge. The goal is to raise $5 million for the Nelune Comprehensive Cancer Centre at the Prince of Wales Hospital campus in Randwick. The Nelune Comprehensive Cancer Centre will deliver state-of-the-art facilities, providing treatment and post-care to patients at the one centralised location. The centre will provide services to more than 1,500 new patients and up to 5,000 inpatient cancer treatments a year for patients from Metro and regional New South Wales. Additionally, the centre will be a major teaching and research facility.
I was first diagnosed with cancer in October of 2007. You really do appreciate once you're in that position how awful it is.
I kept a diary and I felt as if I was writing a film script, except that I was the protagonist, which was not a good feeling.
I mean, I pretty much lived in the hospital for 6 or 8 months. It becomes your home, and that's really difficult when your home is kind of falling apart.
There's nowhere to go when you're having your chemo. You can't go and sit anywhere quietly. You know, you're pretty much stuck to your bedroom.
I loathe coming into that oncology day centre. If you weren't depressed before you went in, I think you certainly would be after. Now, having said that, it's nothing to do with the medical and nursing staff.
The staff are beautiful. The care is really, really wonderful. But just the decor and the feeling of it feels very, very Spartan.
Prince of Wales Cancer Service has been here for a very long time, about 40 years. Services have grown up where there's been opportunity and space. And as a consequence of that, 40 years later, it's really terribly difficult to just keep patching up things. They just are no longer fit for purpose. We're left with a cancer service that is really world's best, but is being delivered at lots of different spots on the campus.
There's surgeries in one area, radiation oncology is in one area, medical oncology is in one area. They're all in different areas, oftentimes with computer systems that don't actually talk to each other.
When I'm in the middle of a chemo haze, because you are very sick, and to try and figure out what does Dr. So-and-so need, diagnoses and scans and x-rays was always a bit of a puzzle.
So about 3 years ago, everyone got together and decided that we should build a new centre.
With the new cancer centre, we'll be bringing almost all the facilities we need into the same building. Being in the same building close together allows time saving for both patient and staff, and perhaps even more importantly, minimises the risks of mistakes being made.
I know in planning the new cancer centre that all of us, from admin staff to nurses to specialists to patients, were involved in the planning. So right down to the fine details of where the coffee's going to be made, where you're going to sit for your chemotherapy, how much room do we need to see patients, not just how it will run, but how it will look.
The physical design of the building is extremely important for the staff, patients and their families. One of the things we're particularly concerned about here is space and light.
The fact that there'll be a welcome area when you come in, I mean, it's such a small thing, but people will be happy to come there and feel confident and comfortable.
So what we're hoping to deliver with this new cancer centre is really a one-stop shop, a place where a patient can come and everything is really about the patient. That will make life much easier for the patients, for their families, but also for the healthcare professionals who need to provide that integrated service.
So being 16 when I was diagnosed, obviously I was on the cusp between the Children's Hospital and the Adults Hospital. I was dealing with two institutions that rarely really speak to each other and that don't communicate at all. So you're juggling a lot of things as a young person, and it puts more weight on your shoulders to get it all right, particularly when at the end of the day it's your life on the line.
One of the most complex cancers to deal with is adolescent cancers, or cancers that are occurring in the age group 16 to 25. You need a combination of paediatric cancer doctors as well as adult cancer doctors. And it's for this very reason that this site is the site of the first Sydney Adolescent Cancer Unit. And this will be part of our new cancer centre here at Randwick.
We don't have a dedicated space for young people. Young people aged between 15 and 25 have significantly lower survival rates and have more psychosocial distress. Cancer therapy is very stressful, and it's really important that young people have time to either be alone or to do some of those things that they would normally do on a day, whether it's homework or university work or just reading a book, and at the moment they don't have any space to do those things.
The age you are when you're diagnosed will really influence your treatment, which I've always found really confronting.
It's really important for us that young people can have improved survival and have a cancer journey where they don't have such high levels of psychosocial distress.
The state government initially put down over $30 million towards the cancer centre, and then on top of that we needed additional funding. The Nelune Foundation has pledged $5 million towards the centre. I think this is one of the most ambitious projects that the foundation has embarked upon, and I think that the level of confidence they've shown has been inspirational to the health professionals at this site, and I think has also inspired others to support this project in all sorts of ways. The distinguishing feature of this cancer centre is that it's a public facility.
Cancer, I think, will affect everyone, and it's really important to have those facilities available for everyone.
Public facilities often don't have a very strong history of donations, so I think this is really a classic example of where the public can make a major difference to the lives of many cancer patients.
I can only speak very highly about both the medical and the nursing staff in the time that I've been coming here to Prince of Wales.
The staff are beautiful. The care is really wonderful.
It's necessary to have the physical support and the physical help as well as the emotional support.
From the very young to the very old, for the rich, for the poor, for the most difficult patients, from adolescents. I can't think of a single type of cancer patient that a donation tonight would not benefit. Every dollar that gets donated towards this project just has a major effect. It's not icing on the cake. This is actually mission critical support for making this cancer centre a reality.
The Nelune Comprehensive Cancer Centre will make a positive difference to the lives of thousands of cancer patients. But to make it happen, it needs your help. A contribution of $3,000 will provide an IV pump. $6,500 will purchase a state-of-the-art treatment chair, and $85,000 will buy an anaesthetic machine. Please give generously. Your support will enable the Nelune Foundation to help all patients fight cancer with dignity, regardless of their social or financial circumstances.